Before I prepare medications, I'm first going to make sure that I have a signed order in Epic. I'm also going to review the patient's allergy list to ensure there is no allergy to the ordered medication. If my medication room doesn't have a computer, I'm going to print my order so that I can use it to compare my medications to in the med room. First, I'll pull my medication from storage and compare it to the order. This will be performing my first label check. I'm going to compare the name, concentration, and dose of the ordered medication to my medication label. Then I'm going to look at the expiration date. And last, I'm going to look at whether it's a single or multi-dose vial because this determines if I can take the vial with me into the patient room. After that, I can prepare my medication. Once my medication is prepared, I do a second label check. This is the same as the first, comparing the name, concentration, and dose of ordered medication to my med label, checking the expire date and if it's a single or multi-dose vial. I also check my prepared medication to make sure the volume is accurate. If needed, I label my medication and prepare to go back into the patient room, remembering to bring the medication vial or package with me if it's a single dose container. Okay, when you first come into the room, you're going to open up the patient's chart directly to the MAR. And the first thing I'm going to do is verify my two patient identifiers. So Eileen, can you tell me your full name and date of birth, please?
Eileen, Arizona, 7159.
Great, and I show that you just have allergies to pineapple. Is there anything else? And today you're getting Toradol, any allergies to that?
No.
Great. Okay, so today you're going to get Toradol 15 milligrams. That's a 1 milliliter injection, and that's going to go in your deltoid, and that's for your pain today. Do you have any questions?
No.
Okay. Next, I'm going to barcode scan my medication. This will verify I have the right med and open up documentation. I want to do a third label check comparing the name, concentration, and dose of my medication to the order, also checking the expire date and that it's the single dose vial that I have. Now that I've opened up my chart and spoken with my patient, I can take a pause and make sure that I've performed my first 6 rights. I've done right patient by opening up the MAR and comparing my patient's full name and date of birth. I've checked their allergies. I've also verified that it was the right med and dose by performing my label checks. And I've confirmed that this was an intramuscular route for administration. This was a one-time order, so that's verifying my right time. And then of course I spoke with my patient to make sure they understood why they were getting this medication to verify my right reason. Now I'm ready to give the medication to the patient. I'm going to leave this open while I grab my medication and administer to my patient. Now that I've administered the medication to my patient, I'm going to finish up documentation, making sure I document the correct site. I can confirm that it was scanned right here. And then I'm going to do my fourth and last label check, comparing the name, concentration, and dose, checking the expire date, and I confirm this was my single dose vial. I can now accept my documentation of administration. With that fourth label check comes my last 2 rights. Documentation, I finished up on the computer, and then I want to check my patient's response. Are they having an appropriate response to the medication I just administered? Once that's complete, my 8 rights are done, and now I can say I've done a safe medication administration.